Sorry, there's no sound.
Yes, there is no sound.
There is sound, but no music.
Good morning, everyone, and I apologize. Yes, there wasn't any sound, or it was very low. We'll look into the technical glitch, but thank you for joining us. And it's a very special talk we did arrange because of the season and weather, which is changing in the UK, and a lot of concerns, questions, and panic calls as we have a lot of changes in the prescription medications from GP and consultants for hay fever and allergies this year. So in that one, it is very important for us to understand that how and what we can manage. Dr. Mridu not only have been our consultant advisor and expert on Arogam to guide us through with healing hers, but she also has her own very wonderful portfolio of inventing and innovating new approaches, new combinations, and also in the patient care what best to work with. So in hay fever, if you all remember last year, during the same weather, same season, she did Panchakarma, self-performed Panchakarma. And into that, she did address hay fever and allergy. And throughout this last year to this year, in this 1 year, we did follow a lot of patients who actually came back and told us that how wonderful her suggestions to manage hay fever, that they didn't have to take cetirizine or steroids throughout this one season. So that encouraged us to actually ask her for creating something which is feasible, doable, and also easily available in the UK, rather than eating so many herbs and supplement, which still we are not sure it's helping or not. So very precisely, she did that. And I'm very, very glad that that is also having a wonderful results in within the practice. I mean, when we all use, we see these important results and 78 to 92% reduction soon within the first 3 days where they start having the symptoms reduction. So these are very encouraging finding for us, especially for the condition where we haven't found any relief from long-term clinical management, over-the-counter medications. And the season is terrifying because when weather is open, we would like to go out and about. We hardly see sun. But when it's out there, we are more concerned than sneezing and having these reactions. So without any fear, let's celebrate our summer beautifully. And I'm sure Dr. Mridu can help us do that. So Dr. Mridu, all yours. Oh, sorry.
Can you hear me?
Very, very low. Very low, Panaji. Hope I'm not the only one.
Hello?
And Miss Dr. Mridu.
Yeah, hello.
You are
Panaji
here.
is not
Okay,
audible today.
Yes, it wasn't. Yes. Where can I not see you?
Yeah.
Okay. Yes, here you are. Thank you.
Yeah, thank you. Thank you, Dr. Neha, for having me here today. It's again so wonderful to be part of this community and especially to talk about hay fever. It's the thing which is going to affect UK a lot. So I was just reading the news the other day and it was there was a news that UK might suffer from a heat wave at 26 degrees Celsius. So there was a meme running around that our ACs are on 26 and UK is having a heat wave at 26. So that's all depends on the climate and the area you are in. So definitely we'll talk about the hay fever today. And the first thing which I want to tell everyone about the hay fever and the viral fever is that um, hay fever is generally not because of the viral. You all know that because it's very common among you people. There's certainly no reason for this. That why is it happening to you and how it started and how it will progress. That's also not very well known yet. But the thing is, it can happen to anyone who got sensitive to some kind of situation. Like there are people who it's basically an allergy. It occurs very commonly. There are people in India who say that we were doing all the household chores since so many years, and now suddenly whenever we are exposed to the dust, we started to get sneeze, our eyes get watery and all that. So that's basically a hay fever, and it occurs due to sensitivity or just sudden change in the climate. What happens in your case is you have extremes nowadays. The extremes, as in your winters are very chilly, snowy winters, we can say. And when it comes to summer, the and even your day night duration is also changed. That's also one thing that does not happen in India, because generally we have 1 or 2 hour gap in summer and winter. Sun sets at 6 in the winter, and in summer it sets around at 8. That's the only difference we get. But in your case, it's a huge difference of 5-6 hours. So, excuse me, I'm getting a very important call. Can I hold? Please, please. Hello.
Yes, Dr. Mridu, we can hear you. Thank
I think you are muted, Dr. Sharma. Oh, he's on phone.
Yes, yes.
Sorry.
Dr. Mridu was, yes, she's
Yeah.
back. Thank you.
Hello, sorry. Actually, some stuff is getting delivered and the delivery boy is calling again and again. They'll refuse the delivery if I don't pick up. Sorry for that. Where I was, so hay fever. So it's very common in your countries, and there's a report that almost 10 million of people in UK are suffering from hay fever. So that's a very big number, and it's a kind of calamity in your place, because a lot of you people suffer from it, and have also read that NHS is constantly struggling, and NHS is a very big topic in your country for elections also. So they are constantly facing some difficulty that for the solution of the hay fever, because we can't control the temperature, we can't control the climate. So the ultimate relief which we can get is to control our body, our doshas. What we say in Ayurveda, we have to control our doshas, so that way only it has to be pacified. So last year we did a session, and we tell everyone that you need to apply ghee, cow ghee in your nostrils, and that I've said it almost in my every session this time also. And it helps in reducing the sensitivity and increasing the strength or immunity of the body. And the body does not get very prone to allergens and all that. But today we'll be discussing the herbs which are very important and very crucial in the management of hay fever. So why there's a need of drug or medicine at your place? That's because again there's extremes. Your body suddenly gets twisted. If in winters we say there's vat kaph prakop, then in summers it's suddenly a big fall in vat and a quite rise in pitta. So the body also gets very imbalanced, and so that's why the sensitivity is more increased in the people living in such climates. So we have come with a composition of few drugs which are very beneficial, and they're very safe drugs. Hardly any side effects you may experience. I'll not say there are no side effects, but side effects are, if we recommend a dose of 5 grams and you are taking a dose of 20 grams, then obviously there will be side effects, because in the end it's a herb. So basically it's a combination of a few herbs. So we'll be discussing each herb one by one. And the first herb which I'm going to discuss, which is very good for hay fever, we have already discussed it, but when it comes to hay fever, it has very big place. So we need to discuss it again. And that is shunthi, dry ginger. Or sundiu or sont, anything you might name it. So basically it's a dry ginger, but its properties are quite different from ginger. So the basic difference between dry ginger and wet ginger is that it does not increase the pith, rather it pacifies it. Secondly, it's a very good immunomodulator. It helps in the symptoms of asthma, bronchitis, difficulty in breathing, cold, nausea, itchy eyes, anything you say that if a person says, okay, I have itching due to hay fever, some person say, okay, I get a runny nose. Some people say of something else. It treats everything. So that thing is also very, very important. And one more thing is about the shunthi, which we have discussed is that if we can't take ginger for a longer period, because it has certain, acids which can cause the hyperacidity if used for a prolonged period. But shunthi, it can be used anytime. And I tell each one of my patient to take milk even any time of the year. Take milk by adding a little pinch of shunthi in it. And or if you are going to make tea, if it is winter season, then use the ginger. But if there's any other season, then you use the shunthi, because it's the antidote of the tea. What do you say? Tannins and caffeine, which is found in the tea. So it's a very good alternate. So that thing is also very important. That's why shunthi is the first drug of choice when it comes to hay fever, and it is very helpful in reducing the what do you say, headache or indigestion if someone is having some heat stroke or something like that. And the best thing about shunthi is it is a natural pain reliever, anti-inflammatory drug. And the first thing which hay fever does is the inflammation of either nose or any part of the body or the skin or anything. So it's a very good anti-inflammatory drug. So I would like to mention it, and anyone can have and should have shunthi in your diet during this season of for the hay fever or any other immunity booster. It is any kind of immunity booster and immunomodulators. All the drugs which we are going to discuss today, they all are immunomodulators, and they help in increasing. I'm not saying that these things will help you treat hay fever. I'm telling you that these things can cure hay fever, because this year, if you are getting 80% of relief, the next year you will have an attack of only 10%. The next year it will subside automatically. Okay, so these things are very, very important. So that's why me and Dr. Neha have been discussing it for very long. And since this is a very major problem, so we thought of discussing this formula with you people today. So it can be of good help. And one of the sir also suggested that we can, do this disease wise. So it would be beneficial for each and everyone. So that way we have chosen this. The next drug which is very beneficial for hay fever, and I think everyone must have heard of it also, that is mulethi. What we say, licorice powder. It's a kind of stem which whenever someone gets a sore throat or has a hoarse voice, so we just suck it. In India, it's available in households also, and you can also get it in the Indian grocery store also. So for that, what the mulethi is very well known for, thinning the cough. What happens when there is some kind of allergy, our nose gets blocked. There's a lot of congestion around the cheeks, our nose is blocked, head is heavy, there's cough all around. So the basic purpose of mulethi is to thin all of these things. And then it also helps in it helps in healing that problem. Like it heals the lungs, it heals the throat, it has some kind of healing properties due to the a special component or special compound present in it. And that helps in acts as an antihistamine. It's an ayurvedic antihistamine. You can understand from that. If a person is getting too much of sneezing, or too much of blockage or anything like that, so the mulethi is the best drug of choice. And the combination of that all the herbs which we are going to discuss today, that is going to help you in hay fever, in allergies, in fever, mild fever, even in the we use it, this combination, in the malarial composition also. If someone is suffering from malaria, then we also give the composition to that person, because the symptoms of each and every disease are more or less the same, because the person's doshas are imbalanced. There's a lot of cough and a lot of pitta aggravated. Because of that, vat is also getting vitiated because of all those things. So we the mulethi, I have seen the question here, so I'm going to answer it. You can have just 1 to 2 grams of mulethi, and you can boil it in the water and make a decoction out of it, or then it is strain it and you can have it. It's very sweet in taste, so there's no problem in having it also. It's even on the sweeter side, and it is very helpful in the digestive disorders also. And as I say each and every time, in Ayurveda we believe sarva dosha jayanto api mandagni, that all the diseases are caused by the imbalance of the digestive fire. So I was thinking that why this problem, this hay fever, is very common, because the diet is the plantation in these areas are very different than the intake. Plantation is very less, so most of the food is imported. And in Ayurveda, there's a concept of a deshakal. I don't know if you know that or not. That it's said that if you are born at that place and if you eat anything of that place, that's the most beneficial thing you can have. Like if I'm born in Himachal, so the herb, the vegetable, or anything that is grown in Himachal is more beneficial to me than in Punjab or in UP or in any place, at any place other. So that's one thing. That's why this problem is increasing by each year. The number is increasing each year because of the all that things which we can't control, because there will be import export, there will be some kind of germs or some kind of things which are adulterated. We can't do that, but what we can do is to balance our body. And also it's very good for liver health. If your liver is working well, you are very less sensitive to the allergens. That's another thing, because all the first filter for your allergen is the nose. If your nose is very sensitive, allergen is going to enter it, and then you can have the sneezing and everything like that. And if your immunity is not that good, your digestive fire is not that good, your liver is not functioning well, not functioning well as in not having a proper digestive fire is a symptom of liver not functioning well in Ayurveda. It's not the blood test or anything like that, not very huge or vast, but there's some irregularity happening in the liver, then the symptoms will worse. So that's why you need to have a combination of these drugs, because if you are having a starting, then shunthi will help alone, mulethi will help alone. But since you are living in that place and you might be suffering, or someone might be suffering, so they need a composition. So that's why shunthi, mulethi, and the next drug which I'm going to discuss is pippali. Pippali is maga. I don't know if you people know about it. It's a big, big pepper, long pepper, what we say, black in color. And you can sign I can sign a paper that it is very beneficial in any kind of allergies. There's a specific, rasayan mentioned for this, that is called Chausat Prahar Pipali. In that rasayan, what we do, we increase the dose of the pipali every day and give it to the patient. Like first day, 1 pipali with milk, next day 2 pipali with milk, the next day 3 pipali with milk, like that. But you can't do that yourself, because when you take a pipali, you need not to have any other food. So it's totally done in a very, concentrated or very cared procedure. So, but the basic thing is pipali is very, very effective in any kind of allergies, any kind of skin problem, any kind of, bronchitis, bronchial asthma, very, very effective. Pipali. And even you might have seen that if someone gets, cough, we usually mix black pepper, long pepper, adrak with honey and give it to the specifically to the kids. So it's very beneficial for any kind of allergies, and these all are immunomodulatory. Why am I mentioning these immunomodulatory? Because it will not only cure your hay fever, but also heal your sensitivity. So next time if you get in contact with the allergen, your symptoms will either be very less or will be no symptoms. But this will happen by the time, not just one thing. The next drug is Vasa. Vasa, I don't know you all know or not. It's called Malabar nut. And you can all, it's also called Basuti. Most people know it by that name. It's a specific drug used for either pains or for cough, allergies, and almost it's an ingredient of each and every drug which affects on cough. Because in hay fever, if we see according to Ayurveda, it's just cough dushti. More of the cough vitiation is there. So that's why we are going to have the composition which is going to thin the cough, because cough is very concentrated, and when there's uh, a kind of temperature change, then it gets, in some part it gets stuck. So to take that out, we need to have the drugs which are going to thin the cough. So that's why Vasa is another drug of choice for that. And you can, if you use Vasa, Avlehe is a specific drug. Chavanprash, Vasa, Pipali, all the drugs which I'm mentioning here are in Chavanprash also, but they are used as a say adjuvant, not as the main drug. The main drug of Chyawanprash is Amla, and all other drugs are, these all drugs which we are going to discuss today are also part of Chyawanprash. But again, many people ask me that if we eat Chyawanprash and not this composition, when I give them to make the kada, I tell them that these are the drugs of the Chyawanprash. So they ask me, then why can't we eat the Chyawanprash? Because there are all other drugs which are not needed for this purpose. And because Chyawanprash is going to balance your Vat, Pitta and Kapha, they are not going to low. If something is low, that is going to be managed. If something is high, they might get bit higher. Chyawanprash is mentioned for the healthy people, not for the people who are suffering from some kind of disease. For the people who are suffering from some kind of disease can take Chyawanprash along with the medicine. They can't say that I'm going to get well with the Chyawanprash. No, they are not going to get well. There will be 5 to 10% relief, but there is not 100% relief because of Chyawanprash. You can't say I cured my fever because of Chyawanprash, because Chyawanprash has drugs that helps in fever. No, it will not happen. But you can, if you don't have fever and you are taking Chyawanprash, then there is very high possibility that you are not going to get fever. That is one benefit of Chyawanprash. So the next drug which I was discussing is Vasa. So its leaves are used basically. And we will discuss all the herbs, how it looks and how it is used in the last question answer session. So I'll be discussing the herbs first. The next herb is vidang. Vidang is basically in Ayurveda, we say it is very good for, uh, antimicrobial property. It's the best herb for the antimicrobial property. And why this drug is important in hay fever? Because there's allergens. Antimicrobial in Ayurveda, it is called creamy, and anything which is harming or attacking the body is creamy. So vidang is very good for this kind of allergens. And if someone is having so much of sneezing, if someone is having some kind of worm infestation, if someone is having seasonal problems like skin problems, skin allergies, itchiness because of weather change or anything, so the vidang acts very well. And again, immunomodulatory is this, all the immunomodulatory effect of the vidang. It is an antioxidant also, and it is a carminative also. Carminative means if someone is having a mild constipation, then vidang can also cure that. And besides that, it also helps in increasing the vitality, and it is very good for stress and anxiety also, vidang specifically to be mentioned, because again I told you, anything which is attacking the body, vidang helps in removing it. So stress and anxiety is also creamy for our body, because they are attacking our body. So it helps in curing them also. So it's very good for stress, anxiety, for any kind of antimicrobial property. So if there is any viral infection also, then vidang is very good. If there is any allergic reaction, any respiratory problem, any kind of digestive problem, because it's a carminative that I again told you. So these things are very important. So that's why vidang is also a drug of choice for the hay fever. This is a combination which I have made, so you can all get proper relief. Because when we say as a whole that UK is affected by hay fever. So there are different people with different prakriti, with different lifestyle, with different food habits and all the things. So we need to have a composition which works on each and every one, because I don't know each one of you that what doshas you have, what are your eating habits, what are your sleeping habits, how much water you intake, what are your bowel habits. So for that, I have made a composition which helps one and all. So that's why you might be thinking that why there are so many herbs I'm discussing. That's because it's good for one and all. None of these herbs will be bad for you, but it will benefit you in one or other way. And the next is giloy. We have already discussed giloy, and as I've told you, it's called Amrita. So it's like the elixir of Ayurveda. You name a disease and giloy can cure it. So, and giloy is very, very, best known for curing a fever, allergy, uric acid, anxiety, stress, digestive problems, skin diseases, hair fall, eye diseases, blocked nose, nose allergies, any growth in the body. It has anti-cancer properties also. We discussed that also. So giloy is also very important, and we have made a special place. And in fact, I would say the largest ratio should be of giloy. If you make a composition, and the composition will whatever the composition of hay fever, giloy will be the major herb which will be having, because we have discussed a lot about giloy. So if you will have any other questions, we'll discuss it. The next herb is neem. I am sure every one of you must have heard about it, and you must be knowing the benefits of neem. At least it's very good for skin. It detoxifies the liver. It helps in the reduction of diabetes. It is very good for the skin. It is very good for the allergies. And again, it has antimicrobial properties. Antimicrobial properties, as in it will not allow anything to attack you. It is quite different from Vidang. Vidang saves you after the thing has attacked. Neem will not let anything attack. That's the difference. So that's why neem is added in the composition. And one more effect about the neem is that it purifies the blood. So why blood purification is important? Because then your sensitivity will be reduced. And next time if you go near the dust, first time if you get 10 sneezes, the next time you'll get 2, 3. And after a few days, there'll be no sneezes and you'll be free from your sensitivity or the allergens. That dust will not be allergen anymore. So that's the effect of neem. That's why it is added, and it also has an antioxidant and anti-cancer properties. Why I'm saying anti-cancer, and why am I stressing on it? Because we say that cancer cell can only grow if there's a sensitivity. So if they have anti-cancer properties, then they will totally let the sensitivity settle down. There will be no sensitivity in the body, and there will be the balance of the doshas. That's why these things and these compositions will help you in whole allergies, hay fever, cold, anything. And there's a last herb which I'm going to discuss is chirata or chirata, we call it, and it is called the anti-malarial drug. Basically the malarial drug, which is colchicine, that is extracted from this plant naturally. It was extracted from this plant, and now it is made in the lab. So that's a different story. But so chirata is very, very beneficial in malaria, dengue, fever, allergies, viral fever, typhoid fever, you name a fever, and chirata will work on it. It is best for the liver detoxification. Whenever we see any disease in Ayurveda, we work only on 3 things. We hardly see symptoms until and unless they are severe. We work on the digestive fire. It should be normal. We work on the liver, that it should be normal. And third, we see the layer or the organ which is affected, and we increase the strength of that organ. Like if a person comes to me that I have skin allergy, so the first thing is which I'm going to do is I'm going to give him the medicine, give him the food which is good for his skin and his digestive fire. Secondly, I'm going to give some herb which can detoxify the liver. Detoxify the liver means that all the allergens which are causing her skin problem gets out of the body. And the third and main thing I'm going to give the herb that will regenerate her skin, because we believe that everything regenerates, and we all know that science has proven that. So we are going to push the regeneration. We are not going to give the medicine for the acne. Instead, we are going to give the medicine for the skin regeneration, because if the detoxification is done, the new skin will automatically be without acne. So that is the whole combination which we have made for the hay fever. And we discussed with Dr. Neha, and Dr. Neha has come up with a solution to make it available in the UK. And it is, I guess, available to you by the next week, I guess. She has done some great work regarding that, arranging all these herbs in UK, and you'll be getting it in the form of powder, which you have to make the decoctions. If any of you want to use and can advise anyone to use, it is in the form of decoction. And if there is any problem with the dose or anything, then I'm always here to help you people with it. And now we will take the questions. So there are some in the chat box, and then we will discuss this. how to take these herbs. Decoction is best. For this season, decoction is best because if it is a powder, it makes the throat dry. uh, and the decoction is very easily to dissolve, for the body also very easy to go through the blood and detoxify the blood. So decoction is good. And for the decoction, you have to take two glasses of decoction. Put 1 teaspoon of the powder, whichever you are taking, boil it, reduce it to half, and then strain it. I have had experience of, yes, milk aggravates the allergy because it is cough karak. So it increases the cough. So that's why your allergy gets aggravated. So
Yeah, but
yes,
it also, I have written to you because I've experienced this. My husband had allergies, skin allergies, right? And then, and it was certain time of certain ones. So at that time, when we left out milk altogether or animal product, that was fine. But whatever was necessary, like you said, you take it in milk. I would recommend it either take it with honey, ghee, and that powder is always better. But milk is not a good thing for everybody. Be very, very careful there. I've experienced with few people. Yeah.
yeah. Milk causes problem a lot if there is allergies. I totally agree with that. But then again, you can't totally leave. You should not totally leave anything. That is my suggestion and my very humble advice, because if you totally, because you can't say that I will never have milk in my life. You can take it once a month, you can take it once a 3 month, but never leave it. Take it
No.
once in 6 months.
Yeah,
But
I agree. Yeah.
yeah, but never say never type that I'll not do it again, because then again your body gets sensitive. Because what's happening nowadays, people are trying millet roti and they are totally leaving the wheat. uh, Here what am I experiencing? I have patients who have been not taken wheat for 3 months, and then when they eat a wheat roti, they went out, because there's no millet outside the home. They eat a wheat roti and they get a problem in their digestion. Their abdomen starts paining. So these are the things which you should never leave. Now, I've seen it many times. Even I never take milk if someone asks me to, because I know it's a. I always tell to my patient, don't take milk if you don't feel like, if it doesn't suit you. You don't take curd if it doesn't suit you. Don't take butter if it doesn't suit you. But you should take lassi and ghee. These are two things which I totally recommend when it is dairy. When it comes to dairy product, these two things you must have. But it's not like you should not have milk at all. But
Oops.
whenever you have milk, you should take it with dry ginger.
Good.
Can we take mulethi with water? Yes, you can take mulethi with water, but that will not help in cough.
Sorry, mulethi with milk. I just found I had some in my kitchen cupboard. The instruction says take it with milk, and you said you boil it and take water. Yeah.
Yeah, with milk, it helps in nourishment. For hay fever, you need to take it with water.
Okay, this one says helps with acid reflux and indigestion.
Right.
So okay with milk then?
That will help with milk, but for hay fever, you have to take it with water.
Okay. Milk, yeah, boiled milk. Just put a teaspoon in boiled milk, yeah?
Yeah.
Yeah, and my brother's got a very bad cold. You know, you said it thins the mucus as well. So do we give that with water then? Boil it in water and give him that?
Yes.
Okay, thank you.
Ganthoda, what is this? Pipal is not small black pepper seeds. I'll show you what pipal is. Pipali is basically large. You must have seen it. Wait, let me share my screen. Okay. This is pipali. Very easily available. It's from the family of black pepper only. Black pepper is called Piper nigrum. It is called Piper longum. Which herbs help psoriasis? There are a number of herbs which help psoriasis. Giloy is one of them. You can use neem chiraita for the psoriasis also. But there are again, we have to look for the personal symptoms and personal doshas, and then tell you that what we can take.
I've just looked up a long pepper root, pepperamula or pepila. It's also called gantoda because people have asked. So that's true. Gantoda is pepperly, yeah. So that there, yeah.
Yeah. Yeah, can we take all herbs together? Yes, we have a composition made of all these herbs. You can contact Dr. Neha how and where you can get that. But there's a whole composition made of all these drugs. And why this composition has been made? Because it suits, again, everyone. It is Vat. It will balance your Vat. It will balance your Pith. It will reduce your cough, which is very important for hay fever. And moreover, it will help in sensitivity. Vegan can't use milk. Using milk is not a compulsion. You can totally skip milk, but if again, I won't say you can't skip. You should skip milk. You can take soya milk. You should take milk. That's why it's important. It's importance. If you see the importance of the milk, there are almost 10 to 15 shlokas about the importance of milk. Milk is so important for our body. So it's adulterated nowadays. That's why we don't recommend it. Otherwise, milk is of great properties, very great properties milk has. But myself, I don't recommend it to my patient. I will tell you honestly, because of the adulteration. That's the only reason I don't recommend.
Can I ask you a question, please?
Yes.
It's Anita here. My son is epileptic and he takes other medicine for epilepsy. The thing is, he came up with heat hives. The body, skin, it came up as a rash all over the body.
Okay.
What can he take? I know at the moment he went to doctor and can't have antihistamine. He can't have the tablet of antihistamine.
What's the age?
35.
35. Yeah, this composition will work for them, and despite that, tell them to take ghee.
Ghee. Okay.
Yeah.
You mean ghee? How to take ghee?
If you can get a Brahmi grit there, I will write the name. If you get it there, then give him to eat and apply on his nostril also.
Nostril, yeah. I have made a few.
And for eating also.
So, also eating. I have made ghee, cow's milk ghee, just recently. Fresh one. Can I give it to him to just put it on his nostril and drink at night, sort of thing, or 1 teaspoon in water or milk?
You give him 1 teaspoon when he is hungry before lunch, and then tell him to take 1 to 2 glasses of hot water. Like hot, the maximum he can tolerate. And then tell him to eat whenever the next time he feels hungry. When he feels hungry, give him ghee first, 1 teaspoon of ghee.
Okay. 1 teaspoon of ghee with 2 glasses of hot milk?
Yeah, hot water.
Hot water, yeah. Okay, so it will eventually come out from him, because I think he had an allergy due to taking B complex tablets. So this ghee might help. Yeah.
I have blocked nose since quite some time due to fever. Can I smell salt powder? I don't think you will be able to smell because of the blocked nose, because smell is the first thing which gets affected in allergies and hay fever. Which herb can I take for digestion again? And I burp a lot. We discussed it last week. Roasted jeera is good for you, I think. You can try roasted jeera after food. Is organic milk better? I don't believe in organic word. You decide. If you feel it suits you, then you can take it. I don't believe in organic. There are many things selling out on the name of organic here. I don't know about there. So we needed a. I'll tell you one incident why all this happened. We wanted to make a medicine for our research purpose, and we needed a good jaggery, which is sulfur free. And there was a big organic, stall displayed that these all are organic jaggery in Maharashtra. It's 10 years back about. So we took 3-4 samples from there and one jaggery which we bought from normal market. And the result were that market jaggery was much less sugar, sulfury than all those which were labeled as organic. So that's why we don't believe that thing. If it suits you, you can take it. There's a thing in Ayurveda called ok satme. Ok satme means it's not healthy, but it suits a person, like tea. If you think about the good effects of tea, there are hardly one or two, but still most of the people feel headache if they don't take tea in the morning. They don't feel fresh. So that's called ok satme. Like it's not allowed to sleep during the day, except summers. But some people sleep and it suits them. So that's ok satme. If it suits you, then it's okay for you. No questions. What can I take for continuous blocked nose and discharge, have breathing difficulties? You can take this composition, but you can't take anything in your nose. Like you can't apply ghee in your nose because that will block it more.
Sorry, can I just clarify this? If somebody's got a cold, is it better to give them fresh ginger and boil in water, or should we give sunt, the dry powder? Sunt, yeah, to clear the blocked space.
Fresh ginger is very acidic. It will increase the acidity. It's not beneficial to give them fresh ginger.
Okay, so for the cold, yeah? Thank you.
Yeah. Fresh ginger is used in Ayurveda with a medicine for, very strong fever, because it's also very strong pungent medicine. So it's recommended only then. Otherwise, sunt is better.
Okay, so we should not normally be having ginger tea then. My friend boils the ginger every day and has ginger tea. It's not a good idea then.
No, it is a good idea if there's a winter season.
Okay, winter season. Okay. Yeah, thank you.
And moreover, the ginger you boil in tea reduces the tannin effect. It does not it does not have that ability to show the ginger effect because it's mixed with tannin and all the other stuff, and all the prakriti changes when you add milk.
Yeah, no, she has plain water. She takes plain water, puts ginger cut pieces, boils and drinks that water. Plain water with ginger.
No.
No? Okay,
Not
because yeah, she has kapha. I know she has kapha, but yeah, okay.
She should try shunthi. That will help her better.
Okay, thank you.
Where can we order the powder, please? You can contact Dr. Neha. She'll be telling more details about it. That when and how you'll be getting it, but I'm sure you'll be getting it by next week.
Hi, I have a continuous nose blockage and runny nose, and since 15-20 days, and can't sleep also at night. I've been taking hay fever tablets here on and off, but it's really not benefiting me. I take steam as well as an Indian thing, putting either Vicks inside, etc., but it's still not helping. So is there anything immediately which I can solve, because I've just been tired of this and it affects everything.
You have tulsi there.
Tulsi?
Yeah.
So is it I have a tulsi powder, so can I just have it with water or just I don't have fresh tulsi.
You do
I
one
have
thing. You take ajwain,
yeah,
dry ginger,
yeah.
ajwain, shunthi, and the tulsi seeds, and boil it and make a decoction and take it 3 to 4 times a day. Very less quantity. This much of quantity, like 40 to 50 ml, one time.
Okay. So is it like I need to boil it and then reduce it to half?
Yeah.
Yeah. Okay.
And you need to take you can also take steam of this decoction. You make more and then boil it and take the steam of this decoction. Vicks will not eat much.
Yeah. Okay. Okay, fair enough. Thank you.
Sorry,
And
Dr.
definitely try that composition if you have chronic that.
Sorry.
You should take that composition and do tell me results, how you feel after that.
Okay, sure, definitely. Thank you.
Can I ask a question? I was told by one of the Ayurvedic doctor that you have fresh ginger for Vayu, for gas. When he was taking my hand, my nadi, and he said your body has got a lot of gas in there. So is fresh ginger okay? He said that before you have your food in the evening, have some fresh ginger. I mean, it was strong for me, but I just cut it or put it in a little bit of hot water and drink that water. Is that good for Vayu, for gas?
Yeah, taking anything before food basically helps in increasing the digestive fire, and it is given for that purpose also. Your body must be Vat correct.
Yeah.
It is good for Vat, no doubt. But yeah, he must have seen something. You still take it?
I don't remember to take every day, but I do take that. Otherwise, at night time, I have Tripura and herde mixture and put some hot water and drink that. And that is helping a bit. I mean, but I don't know, is it, but I cannot have dal. If I have a moong or any of those masoor dal, mug dal, then I get more gas.
So you can, if you want to take fresh ginger, you just cut the ginger and just chew it like that. Don't make a decoction out of it. And if you want to make a decoction, you should take shunthi, because this, as you are mentioning, you are taking dal. Masoor dal increases pith in some people. You might be one of them, but moong dal hardly causes gas. So if you are, it's even vat shamak, it reduces the vat. So if that's your issue, you can change it to dry ginger.
And I also soak methi, fresh methi powder at night time with little bit of turmeric, neem powder, and that I drink it in the morning. Is that good with lemon and things like that, honey?
How much turmeric?
Just 1/4 of a teaspoon, not much.
Reduce it to pinch, and methi 1 teaspoon will go.
1 teaspoon what?
1 teaspoon methi and just 1 pinch of haldi.
Okay.
Dry drug, and as you have mentioned, you are taking trifla, hare, and all these things. They are also dry. So basically, you are yourself increasing your vat.
I'm increasing it.
Yeah, they are dry drugs for when taken for a longer period. So you either have to mix it in ghee or in some kind of things. Like you choose one. Either you take that trifla hare or you choose methi. Alternate day you do that. Not take both the.
Not same day. Yeah, and I don't take same day. Tripura and holiday just 1 or 2 days in the week at night time I take.
Yeah.
Okay. Thank you very much. Thank you.
Dr. Mridu, can I just clarify? So the tulsi leaves, if you have got fresh tulsi, what is it useful for, did you say?
Sorry?
Tulsi, fresh tulsi leaves. If you make a tea with it, just boil water and put in there. What is it good for? What is it helpful?
It instantly helps in, reducing, clearing your nose or your respiratory tract. That's an
Okay.
immediate.
So just fresh leaves in a cup of tea, yeah? In a plain water, yeah. Yeah, okay,
Yeah,
thank
but
you.
it's not for long-term use, so it's for the instant use once in a while. That's why I've not mentioned it in this composition. Because you get used to it very easily. It does not act like a proper medicine if taken for a longer period.
What does it do to you if you take everyday Tulsi tea?
It does not cause any bad effect, but it will not show the desired effect. That's one thing.
Okay, because I get gas and I just started taking Tulsi tea. It just feels nice.
Yeah, you can take it. What is the
Wonderful,
best?
everyone. I'm sure we have a